Okay, we're live, Chair.
Thank you, Mark. So, a good evening, ladies and gentlemen, and welcome to the Adults Health and Social Care Scrutiny Board on the 22nd of February 2024. It seems quite some time when we met formally on the 7th of December. However, for anyone out there, we did actually meet, had an informal, very productive session on the 18th of January where we did a bit of a walk through the service, and it's really useful to speak to people that are dealing with the issues on a daily basis. It was actually a very useful meeting, even though it wasn't a formal board meeting. So welcome everybody this evening. Substitutes nominated for this meeting and apologies for absence. I have no substitutes and no apologies for absence. Everyone seems to be present, so thank you for attending and making the effort. Item number 2, members' interest. Just remind members to declare the interest at the relevant time if there are any interest to be declared. Item number 3 is admission to the public. It's not recommended that the public be excluded from the items. For all items on the agenda, so anybody out there, you are most welcome to listen into our meeting this evening. So we go on to item number 4, which is minutes of the Adults Health and Social Care Scrutiny Board, held on the 7th of December 2023 rather than 24, to be agreed, which I will propose. They are a true record. Do I have a seconder for those minutes? Thank you, Councillor Prashad. And all those in favour, please. Indeed, thank you. Right, okay. So item number 5 is deputations. This is when members of the public have the opportunity to submit a deputation on any matters on the agenda. I can confirm that there are no deputations this evening. So item number 6, which is really the main part of the agenda this evening, and I'd like to welcome officers for attending this part. So item number 6 is Adult Services and Wellbeing Transformation Plan, and I'd like to very much welcome Anne and say you're doing a splendid job in your interim assistant role. So would you like to lead? I understand you have a presentation, so I'll leave the show to you. Then we'll then ask members to ask questions. If we can leave the questions to the end, if that's okay, members, then we can go through the slides.
Thank you, Councillor Blackburn. Just on a pure. Oh, sorry, I'm speaking over somebody.
No, you're okay. Continue. Yeah.
I've got a bit of an echo. Just on a purely personal basis, I'm no longer interim. I was interviewed for and appointed to the permanent role a couple of weeks. So this is my second week as a permanent member of staff as the Assistant Director for Operations in Adult Services and Wellbeing, which I'm delighted about.
Fabulous. That's news to my ears. So congratulations. I'm really pleased. You made quite an impact when you came to Calderdale previously to our directors. So very big welcome to Calderdale, which is the centre of the universe. Let's face it, other than Big House.
Well, thank you very much. So this is between myself and Jill. So we're the 2 assistant directors. Jill is for on the commissioning, procurement, quality, integrated commissioning for adults and children's side, as I'm sure you know. And I'm now the permanent director on the operations side, which is the adult services and wellbeing, social work, occupational therapy, palliative care, learning disabilities, mental health, etc. That sort of remit. And Libby, just as I thought, I can't share. It's still not letting me do that. I'm sorry about that. So if you could share our Jill and my joint presentation or try to do that, that would be really helpful. I have tried to do and it's not allowing me to.
It's also not allowing me to. I'm not sure if I might need to be made host.
Okay, Mark, if you can arrange that, that would be superb. Technology is wonderful until it doesn't work.
Oh, hold on. It actually might be letting me do it now.
Yes, it looks like it. The screen's on.
Okay, let's see if I can get it onto a slideshow. Is that on a slideshow now? Can you see that?
Looks like it is. It looks like it is.
Okay.
No, it's just gone back to the slides on the left-hand side. Just go back.
Right, I'll stop sharing, Libby, and I'll leave it in your professional hands to try to sort that out. while you're doing that, I'll just say that what we're going to cover this evening between Jill and I is some of the major changes that are happening across the directorate. We're not covering every single bit of the change because there's such a lot that is going on. There's so many changes that are happening. So we've picked out, I suppose, the highest impact and the most pertinent changes to talk to you about. But just to say that we also are working very closely with our ICB colleagues on integration and further integration wherever that makes sense for Calderdale residents. And so some of the things we're not covering tonight are the integrated hospital discharge arrangements, which we can cover another scrutiny if that would be helpful, although I imagine that's probably been through scrutiny before. That's working very well indeed, and is very well embedded, and the partnership is very strong. I'm not going to cover the changes to the disabled facilities grant tonight or to the improvement plans for occupational therapy, but again, we can do that at another scrutiny if that's helpful. And I'm not intending to cover the general improvement plan that we've got for adult services and wellbeing simply because of time. Although if anyone's got any questions, clearly Jill and I are more than happy to answer any of those. So Libby, if you can move that to the next slide, please. What we are going to cover, so I'll start with the operations side and I'll make sure that I leave plenty of room for Jill on the finance and care charging and case management system developments, because they are absolutely pivotal underpinning elements that will really allow us to develop and embed the changes that we're talking about on the operations side. So broadly, the agenda will be community-led support and strength-based practice, which I know will not be new to any of you here in Scrutiny or anybody listening, because Calderdale has been talking about this and doing this work for some time. Josh's children, exclamation mark, Josh. Yeah, so you haven't missed much, Josh, because it took us a while to be able to share the slides. So this goes across the board with the 3CPB partnership, with all the work that's happening in general practice, in community services, in the hospital, and in the local authority. It cuts across the work that is being done by officers like Sian Rogers and Faye Henderson, who are working on the voluntary and community sector strategy, the inclusive economy strategy. So there's a really clear golden thread through pretty much everything the council is doing that is focused on community-led, community power, strength-based practice. I'll talk a little bit about an offer that is brand new, hot off the press this week from the Local Government Association and the National Development Team for Inclusion. I'll go into a bit more detail about the Gateway to Care development. So that's our in the jargon front door, so the place that people come to first of all, who when people are looking for support, information, advice, guidance from the local authority, they'll come through to our Gateway to Care front door in the first instance, and we're making some quite significant changes there. We're also making some fairly well, less significant but really impactful changes around how we deal with safeguarding, which I'll talk you through. And UCR is short for the Urgent Care Response Pathway. I'll talk you through them, and then some fairly high level coverage of what we're planning with our day services, which I know scrutiny members will be clear has been on the agenda for some long time, and we haven't had the capacity to deliver on that. And then I'll hand over to Jill to talk about the fairly major changes we're making in our finance and care charging arrangements. I'll leave that to Jill to cover, and the absolutely key underpinning arrangement around our case management system developments. So that's the agenda. Before we move on to the next slide, I'll just talk to you about the NDTI and Local Government Association offer. So we have been looking for support, funding support, to really accelerate our culture change and our practice change in community-led support and strength-based practice. I'm very pleased to say that we have got funding agreed through the Better Care Fund to deliver that. I'll talk a bit about that further on, but we've also just had some very good news a couple of days ago that through the local government association offer, there are 3 councils who have been selected to work with the National Development Team to start that work. So that it's called the Getting Ready exercise. It's the very beginning piece of that work to make sure that across the whole system, ourselves internally, our internal departments, our partners, that we are really ready to make the changes that we have been talking about making for some time, and that we're in good shape to receive the support from the NDTI or others to help us to really accelerate that. So that is a funding offer to help us to get ready for that major change. And the second element of that, which will follow the completion of the Getting Ready, is we are hoping that LGA will provide funding for the first year of that change programme. And that will be really, really helpful for us, because it means we can get moving more quickly, and it also allows us the time that we need to go through a full procurement process for a long-term offer. So that's good news, very, very brand new, and LGA are hoping that we will complete that by the end of March, or largely complete it by the end of March, because it's only just been announced. Libby, if you can move on to the next one, please. Thank you. So our front door developments, we have known for some time that we wanted to work with the delivery partner to really help us to accelerate this work, but we haven't waited for that to happen. And we've really, the team actually have worked incredibly hard to think about how we can transform that front door offer now. If you can go to the next one, please, Libby. Some of this is about our public-facing offer. So what do people who find themselves in need of information, advice, guidance, or a support service, what do they experience now when they come to Calderdale Council for that kind of support, and what do we want that to look like for people in the future? And that's based on feedback. It's based on a really good understanding of our performance data, our complaints, so what people tell us is not working well now and what needs to change. So one of the things we're doing is completely changing our web offer. Completely aware that doesn't that not everybody can access a web offer, and not everybody is online, and we'll come on to that in a bit. But our web offer is hasn't been very strength-based, hasn't been very easy for people to navigate. So we've done a huge amount of work led by the team in Gateway to Care to develop a new web offer so that people can find the information, the advice, the guidance, the access to services that they need really easily and in very straightforward language. No jargon, no complicated onward referrals. No, that's not us. You'll need to contact somebody else. So something that really helps people to get what they need very quickly. Next one, please, Libby. And we calling it Calder Connect. We were able to buy the domain name actually very cheaply, so that was a huge positive for us. The website needs to be accessible, which means that the language has been is pitched at a reading age of 7, which we know from research is about the right reading age to pitch any of our public facing information at. It's completely jargon free, we hope, although we are testing that with internally, and then we'll test it in public, and we'll act on any feedback that says we don't understand this, or that you have used jargon here. It's up to date. It's been co-produced, so it's been developed with staff, with voluntary sector organisations, with provider organisations, with some resident groups, although I think we'd hold our hands up to say that we could have done better on that, and we will do better on that with the developments that we've got in place through our co-production offer in future. It has a read across to what our legal and statutory duties are and what CQC will be looking for when they come to inspect us in due course. And it's very much focused around people and individuals and families. So we use the I and the we statements, and it hasn't cost very much money for us to develop it at all. And that's largely due to the efforts of some of our amazing staff in Gateway to Care who've just really busted a gut to get this in place in very quick time and for very little money. And you can see the tiles, the way it's laid out. It's very straightforward. So staying at home, staying safe, getting out and about, money and finances. So no fancy language there, very straightforward. The next one, please, Libby. This is the timeline. So there's been a lot of work being done in the last 6 to 9 months. During this month now, we're making sure that everything that's on there is up to date, that everything is linked correctly, that people can get to where they need within 2 or 3 clicks. Next month, we will update all the details for the information that's on the directory, and then start to encourage more people to put their information on there. So we've created the platform for anybody to put information on there to help people to access what's available in their local communities. We will have a disclaimer on there because we're allowing people to upload their own information. We can't guarantee to have validated every single thing that goes on there. So there might be a small, I don't know, a Domino's club or a knitting club, or we can't validate absolutely everything. So we want to have a small disclaimer on there, but with the opportunity for people to report anything that they're concerned about. But it will contain our commission services and our services that fall under the umbrella of the what's it called? Voluntary Action Calderdale, the VAC, the VSI Alliance umbrella. We're going to test it then. Once we've tested it internally, we'll test it in public in the Lower Valley, and we'll get more feedback and we'll iterate it further. We'll then assess and implement any feedback from the testing, and then we will start to get ready to get it out to everybody in the whole of the authority. And we will really actively promote the website to communities. We'll really focus on a good, clear communications plan. We'll keep on taking feedback, and we'll keep iterating it as we go, and continuously improve it, develop it and modify it. So this has been a long time in the making, I think, for us to have a really good, up-to-date community directory. So we are feeling very positive about being in this position to get it out into the world in the next couple of months. Next one, please, Libby. We're also now making available an online contact form. We've had lots of feedback about some of the difficulties that people find, whether that's residents or professionals in getting access to us in Gateway to Care. Some of that is because we haven't provided sufficient channels for people to contact us. So it's largely by telephone or by email, and it's largely exclusively during working hours. So we've developed an online request for help from adult social care form, so a wellbeing contact form. It's available 24 hours a day. It's very straightforward. It collects a lot of the basic demographics information that we would otherwise need to have conversations with people about, and complete that, upload that information onto our screens. It will cut out time for us, but more importantly for the resident on the other end. And the emphasis is very much on what is already working well in somebody's life, what is most important to them, and then on what it is they're looking to us to support them to access or to achieve, and what the outcomes are that they are looking to achieve. Now, it's a fairly nuanced shift, but we know that if you ask people lots of deficit-based questions, tell us all the things that you can't do, it's not an empowering way of working with people. Tell us all the things you can't do. We'll assess whether you're eligible or not. If you're not eligible, that's not great because you've already told us about the things that you can't do, but we're not sure how we can help you. If you are eligible, then we tend to focus on putting in some direct paid and statutory services. What this will help us to do is to look at the whole of that person's life and have a much more holistic view of what is really important to somebody's quality of life, not just, for example, I need help with medication, and we focus on that, but we don't look at things like social isolation, loneliness, and those kinds of things. So it's a nuanced shift, but it definitely makes a huge difference. Next one, please, Libby. Telephone calls. We have a lot of calls that are dropped at Gateway to Care that people can't get through to us because, as I said, we haven't given enough options for people to get in touch with us. So we're developing a new telephone system that means that people can get routed more quickly and more straightforwardly to the particular people they need to speak to in Gateway to Care. Whilst they are waiting, they will also be given some further information that tells them how they can access help in different ways. So if they're waiting for some time and actually they know that what they need help with is, I don't know, a Care Act assessment or a safeguarding concern, they'll hear information that tells them how to get to that particular support more quickly. And they'll also be given information about how they can contact us through other means. So we're pretty confident that will reduce the number of dropped calls, and dropped calls are enormously frustrating for people. There's also an impact on us because people will then call back again. But the main thing is that people need to be able to get in touch with us the first time they call. So we're going to monitor this carefully. Not everybody likes the press 1, press 2 type of options, and some people will find that more difficult than others. So we're going to monitor that and think about whether or not that is the best way of doing things, or whether we can tweak that to improve things for people with different needs, such as sensory needs or learning disabilities. Next one, please, Libby. Then the way that we have conversations with people when we do speak to them on the phone or have their electronic referral. Again, this is about behavioural insights, helping us to focus on what it is people have in their lives that's going really well now. Focus on prevention, on potential, on thinking about things like assistive technology, on minor aids and adaptations, those kinds of things that we know can be life-changing for people and stop them needing to come into more formal sorts of care arrangements. Support for carers, a really clear recognition of the input and that carers, paid or unpaid carers, make to improving people's lives. We're removing the focus on eligibility at this stage. The Care Act has done many positive things, but it has driven us down a very strong focus about whether or not people have eligible care needs. We just need to listen hard to what people are saying to us, help people to tell us what their wishes and goals and feelings really are, not just the things that they can't do. In huge numbers of these calls, we should be able to provide people with the right advice and information and guidance that they need, reaching, a conclusion and resolution and a way forward. Ideally, we need to be looking at, for people who are not in crisis, how can we do things in a way that supports their existing networks or helps people to help themselves or connect people into what's available in their communities. And then if we need to put statutory and paid support in, and we will do for many people who contact us, we're doing that in the context of this broader thinking about the quality of people's lives, not just in plugging those sort of deficit things that people can't do. Thanks, Libby. The next one. And the next one, please. So Calderdale had a programme called Better Lives in 2015. Next one, please, Libby. That was really innovative. Calderdale does so many innovative things. This was one that was halted, and COVID was partly responsible for kind of pulling back on this. We want to reinvigorate that, which is all about getting our staff out of mainly the Shay into communities, working with our voluntary and community sector colleagues, working with people like income maximisation, benefit maximisation, debt recovery, fuel poverty, all of those sorts of things. Diabetes checks, podiatry checks, those NHS community services in communities where people live, not expecting people to come to us, not expecting us to always go to visit people in their own homes. It's much quicker. We'll offer appointments, but we'll also let people know that they can just walk into any of these. We're calling them talking points. They're informal, they're face-to-face contact, they're quick, they're easy, they connect people to people and to community assets. That will have a huge impact on our waiting list, which means that far fewer people will be waiting a long time, far fewer people will be having to be internally referred or referred between us and other organisations. And we know that it works. It's worked in Calderdale in the past, and it's working in other parts of the country. And we need to reinvigorate that and get it back on the map. We'll start I think we're starting in North Halifax. Yes, we are. And then we'll test and learn from there, and then we'll spread it out across the borough. Next one, please, Libby. Safeguarding team. We've had, I don't know if people are aware, but we've been an outlier in safeguarding concerns in Calderdale for many years. We have a huge number of concerns reported to us as safeguarding, which are not safeguarding. They are concerns, but they are primarily quality concerns or other sorts of concerns. They're all coming in as safeguarding. That means that we're having to we're spending a huge amount of resource on triaging what's in those concerns. We're worried that we might be missing some things that are serious in there because of the large volume, and we're concerned about the amount of staff time that it's taking to, I suppose, triage and process things that aren't safeguarding concerns. So we have a very low conversion rate of the things that come in as safeguarding concerns that actually turn out to be safeguarding concerns. That in turn has an impact on the number of safeguarding inquiries, Section 42 inquiries, that we're able to undertake, and we have a delay on those inquiries. So we are trialling a new process, a new team, and safeguarding thresholds now. We're just starting that now, with the intention of moving to a multi-agency safeguarding hub in the future. Next one, please, Libby. So we've developed the dedicated team. We've actually, since I've written this, we're completely, we've recruited to all of those roles now. Everybody who's in post is being inducted, and we're looking at this is the mechanics of where things sit across the different teams. We're moving all of those things into the right places with the safeguarding team. They will be a dedicated team who will deal with everything from concern right through to Section 42 inquiry. Anybody who is already has a social worker, allocated social worker in another part of the organisation, they won't have to change their worker. Those staff will continue to carry out those safeguarding inquiries for that and maintain that relationship with people. But this will take a lot of work away from the teams who are experiencing lots of waiting lists and waiting times, which is not good for residents. So it will give us a dedicated team for safeguarding, and it will relieve some of the pressures on some of our other teams. Next one, please, Libby. Because of everything that I've just described, we have these huge numbers of inquiries that come in. Many years ago, that a decision was made in Calderdale to remove all thresholds for safeguarding. That's related to a care home which had serious concerns and was in large-scale inquiry. That's meant that we've had, as I say, many things come in as a concern, and then we've delayed on the Section 42 inquiries. So we've got a very coordinated effort to clear all of those outstanding inquiries, make sure that everybody who is affected by that is safe and is having their safeguarding concern properly and robustly investigated, and that we're confident that people are safe in as a result of that. Next one, please, Libby. I think I've covered this actually. So we'll have the safeguarding thresholds, we'll have our training and engagement with our partners, and we'll have clear communication to everybody about the new pathways, much clearer lines of sight on safeguarding concerns, and an ability to track themes and trends, which will be very helpful for us with our Safeguarding Adults Board. And then finally, Libby, the multi-agency safeguarding hub, our partners are very much on board with this, very keen for us to develop a multi-agency hub. Once we get our house in order in the local authority, we'll be in a good position to move to developing that multi-agency safeguarding hub. And the next one, please. Urgent care pathway, we will have a single point of access for people coming out of hospital or preventing people needing to go into hospital. We'll have a much more personalised and holistic assessment of people's physical, mental health and social care needs. So wrapping everything around the person, not having lots of different independent teams. We will have clear pathways for onward referral, including primary care, mental health and the voluntary and community sector, and much clearer communications about what will happen for people when they are discharged from hospital. Really rapid response for people, supporting people at home with their physical health needs and mental health and social care needs when they come out of hospital, making it much less likely that people struggle when they get home from hospital, and much less likely that they are readmitted to hospital. I think I'm nearly there, Libby. Have I got one more on daycare? No, that's just the graphic for that. We can move. Yeah. And then day service. So we've wanted to, in Calderdale, transform our day services for some long time. As I said, we've got the funding for the delivery partner for community-led support, and we're still looking at identifying funding for a full review of our specialist in-house and commission day services. And we're in conversation with various people who are really expert in this to act as our delivery partner to help us to make sure that actually gets off the ground. And we're looking at repurposing the transformation lead funding to bring a delivery partner in, hopefully by the end of March. I think that's me. And over to Jill, unless Councillor Blagborough, you want to stop at that point and take any questions, or if you want us to continue.
I think there's a lot of questions, so let's leave them to the end. Let's get to the end of the presentation, because I know I've got a number of things that I'm sure it feels like a pit stop tour, but actually, we'll be homing in on some of the more details. Yeah. Well, certainly an item that's going to be on our agenda for quite some time, as you can imagine. So we're going to be very much your critical friend tonight. So
excellent. I'll hand over to Jill.
Continue, please. Yeah, thanks. Thank you.
Okay, thank you, Councillor Blagborough. So in this slide really is in regard to some changes we've been making in regard to payments and charging functions. It's actually much broader than a care payments team. So what we have done is a significant amount of work on trying to realign services and functions that sit better together, so that we can ensure expedite the way that we make payments and respond to inquiries and reduce delays in the system. So actually we've put in place a whole new structure of a systems and a service for systems and finance. And what this structure does is actually brings together direct payments functions, brokerage of home care functions, and the way we make social care provider payments. Market sustainability is absolutely key to us. We know it's quite a fragile care market out there, and it's really important that we support particularly our smaller providers in ensuring that they receive timely payments. So this new team was established in January of this year. We've also realigned the financial assessment functions and debt functions in terms of charging and debt. That's set separately previously because they are much more neatly aligned. And then as part of the new social care case management system that we're just starting implementation of, we've brought the system structure. We've just recruited a service manager who commences in post on the 18th of March. So this is a really significant development, and what this new structure does is kind of works in much more collaboratively with the operations services social work teams in supporting them in how we communicate and work with people that we provide care and support to in the community. Next slide, please, Libby. So some members on the call council on the call will be very well versed with the financial assessments and work that's been taking place through audit committee and an audit improvement plan. But we have launched a new financial pathway. We've set ourselves a very, very ambitious target of working towards completing assessments within a 6-week time frame. I can tell you that there is no national target for completion of financial assessments. We've tried to do some benchmarking with other authorities in West Yorkshire, and we know some other authorities are working to currently timescales of 18 weeks and trying to reduce that down to 12. So the 6 weeks is an ambitious target, and we will have to continue to review that to see how realistic that is. We started from October trying to split the financial assessment team so that we've got some of the team working on backlog and some of the team working on new cases. It's really important to note that the team are not only working on financial assessments, they are also working on changes to packages of care as well. We've made significant improvements with a backlog. We did have a significant backlog that was round about the 800 mark in October. This slide states 149. That's it's actually, we have 360 in total, but that's because some of them are in progress. So we have a backlog of 360 not completed, but if we remove the ones that are in progress, that would take us down to 149. So that explains the differential figures. Recruitment's underway. We are strengthening capacity in the team so that we have improved management oversight and ability once we're on top of the backlog to have timely reviews of financial assessments and ensure the accuracy of information. We launched a new financial pathway on the 18th of December for social workers and toolkits to support them in the information that they take out to people when they are meeting them to undertake assessments. So some of the assessments that predate the 18th of December and the new ones we've been working on from October may not have had the full financial information. And next slide. So this is just the new, it just gives you a visual of the new service structure we've put in relation to the case management support team. So we have a dedicated team manager there for the new system, arranged with a number of case management system support officers that will support the training, embedding of the new system. We want to ensure that the new system is as intuitive as it can be, and that it provides readily accessible information. So this team will be crucial in getting beneath current data, supporting the accuracy of data that transfers from the new system, along with specialist data migration officers and analysts. And then the final slide. So we have just signed a contract with for the Mosaic social care case management system. It is a contract for adults and wellbeing, as well as children and young people services. The initial, what we call kick-off meetings, have taken place in January. We've now got a whole host of workshops that are scheduled and timetabled with practitioners, and some of the work that my colleague Anna's just outlined in terms of these new systems and processes and standard operating procedures are absolutely crucial to the way that we configure this new case management system. There's been some initial training that's taken place, and as I've said, we're working on the standard operating procedures, and there's a whole host of work that's already started place in terms of data cleansing activity, and I think that concludes the presentation, Libby.
Thank you both, Anne and Jill, for the presentation. Gosh, where do I start? You've had this, you've been dealing with it for quite some time. It's new to a lot of us this evening, and there's just so much that I just feel is not there, and we're not being told. And I just feel we need a full written report with clear plans, timescales, costs. Just to name a few, and that's just in a few seconds. I know the members will be coming in, and things like what needs to go to cabinet, what has been to cabinet, things like restructures, for instance. So there's a lot that we need to bring back, I think, and I think I'll let other members have their piece, because I don't want to take the thunder off anyone else's speech. But certainly in my mind, it looks very simplistic. It looks very easy. However, it's just a minefield of information that we don't have the answers to, I think, at this stage. And I'm sure it will become, hopefully you'll convince us and assure us it'll become clearer as we walk through the process. So quite a few things that we will pick up as action plans as well. So I'll start off with Councillor Barnes to start with.
Thank you, Chair. And whilst I recognise and thank Anne and Jill, and obviously this is a major, I don't think we can scrutinise this. Not tonight. I think there's no chance. I think I've got more questions than we can ask, and I suspect other members will have the same. It is disappointing that we're presented a verbal report and we're not presented a verbal report. What's the general improvement plan? It's hard to ask questions when we don't know what it is. There's almost an argument to say that tonight's been cherry picked with some of the things that that you wanted to tell us, not what we wanted to ask. And I think really we should have had the opportunity. No, not think. We should have had the opportunity to see this whole thing and actually make a decision as to what we wanted to see and what we wanted to talk about, and not have 40 minutes of it and us all sitting here writing notes, scribbling notes, and not having the opportunity to really go into any depth of this. So I can go through questions until I'm blue in the face tonight, and I think everybody else can. But I have to say I'm disappointed. I think the key question is what's gone to cabinet, what is going to cabinet, have they approved the team changes, has this whole transformation plan, when is it going to cabinet? we need to be looking at it, and we need to be making a recommendation to cabinet. We need to be scrutinising it, and we don't have it. I didn't hear one word tonight about co-production, and yet in multiple meetings we've had so far, we've been talked about co-production. We talked about the change to the front end, which seems to be that digital is now the channel of choice. What other means are they if they can't access through the telephones? We'll tell them about other means to access. You mean digital? I'm going to stop there, Chair, before I say anything I regret.
No, that's fine. I think one of the action plans straight away, in my view, is actually Councillor Barnes, myself, Mike, and Libby getting together with Anne and Jill and Kath, and just thinking about what we want to bring back to the next meeting as well. As some of these questions, I think there's got to be an awful lot more questions rather than and some you may not have answers for. So I'm going to bring Councillor Hutchinson in first of all.
I share the frustrations that have been expressed by yourself, Chair, and Councillor Barnes, that, it would have been, I'm gobsmacked that we've not been given papers beforehand to try and actually get our head around the report that's been presented. I'm not clear at all what problems these changes are designed to address. I'm not sure whether the problems are ones that have been raised by service users or by the financial situation that we're in, or by staff, in terms of staff retention. Until we know what problems they're designed to address, we can't say what needs to be put in place to make sure that they do end up addressing those problems. I have a lot of questions about some of the detail of what's been presented, but I think those would be out of place until I feel I understand the big picture. And at the moment, I definitely do not.
Thank you, Councillor Hutchinson. Councillor Fenton-Glynn, is this on the back of what's been said, or is it a separate thing? It's always confusing as to when I bring you in, so my apologies.
Yeah, I mean, I think I just want to give a bit of a kind of 10,000 feet view, because I think it's easy to look at what's not there, and actually we could bring you could have brought you kind of fully fleshed out plans, but actually that gives you less of a chance to have an impact as a scrutiny board, because that comes at the point when we've already decided things. We are at the start of the process of looking at a lot of things, and yet some of the some of these things were just in terms of background, kind of we've had COVID, and then we've just had incredibly large system pressure, and we are now coming onto things and actually just trying to be a bit more proactive with how we kind of build from there and make sure that we bring our service up to date. In terms of Colin's question, which is a perfectly reasonable one, which is what questions are we seeking to answer, and what problems are we seeking to address? I think it's part of what you said and more. So I think some of it is service users kind of responses, and we've actually put a lot of work into co-production, but it's not mentioned in the presentation. We can, if that's the element that you specifically want to look at, then maybe that's something that would be very worthwhile for a future meeting. So some of it is service demand. Some of it is obviously money, because we don't have any. And some of it is, frankly, that our service is a bit antiquated, and there's been kind of a need to bring some of it up to date for a while, and it's not happened because we've had COVID, and then we've just had tremendous system pressure. So that's just a bit of a background. So I appreciate that you want all the information all at once, but actually some of this is giving you a sense of where our early discussions are, so that you can feed in, and I hope that we can kind of move into the kind of the answers and the substantive a bit more, and maybe this gives us a chance of where we do want to, you know, where we do want to scrutinise more over the coming months.
Yeah, thank you, Councillor Bentingley. I think I think it is we do need the fuller picture, but we need to break it down equally. So I think it's a balance of the two. We need the whole picture so we can see what it is. Clearly we ain't got time to scrutinise all this in one night, but we will be. This is going to be a major element of our work programme next year as the transformation continues. So I think it is, and I say there will be some. We are, as I keep repeating, we are your critical friends, so we're there to support. Jill, do you want to just come in on the bits that have been said at the moment?
Thank you, Councillor Blagborough. Just to say, in terms of the questions around Cabinet in regard to some of the areas I've touched on, there was a full Cabinet report in October 2022 relating to the case for the new case management system and the establishment of the permanent support team, an agreement of capital funding for this as a whole new project. With regard to the service structure I've outlined for finance and systems, this is moving, it's making no kind of it's realigning functions and moving them from operations across to commissioning. So from a HR perspective, there's no restructure. It's moving blocks across under new line management. So with that respect, there's been no posts affected with regard to the actual structure. It's been more about realigning roles and then some additional roles to strengthen management and leadership capacity. So I just wanted to clarify those points, if that helps.
Yeah, I think it does. I think what might be useful as well on the back of that is actually having some timescales as to you mentioned October 2022, and it's quite some time ago. So I think it's that refresher. Then these are bits that have already achieved in the timescale moving forward. And yes, I think that's key. I'm going to bring other members in. I'm sort of conscious of our time and your time. Councillor Kingston next. I have.
Thank you very much. The Calder, I think it was called Calder Connects. Was it Calder Connects, the website that you've created? I remember in conversation with Katie Clark last summer at the Social Care Futures event that she was looking for something in Calderdale for Calderdale Council to facilitate. What would it? And I wondered if this is what the directory is. A forum of some kind, like an advertising page where people in receipt of direct payments could advertise for people to work for them, and also where people who are working in the care sector could advertise their skills with regard to becoming employed. So like a two-way forum for people to engage one another with regard to direct payments. Is that part of the Calder Connects website? Is that going to be part of the Calder Connects?
Shall I come in here?
If you can, yes, please. Yeah, that'd be super. Thank you.
So it isn't because we have a PA register and a different arrangement, but it's a really interesting thought about whether we could bring that into the Calder Connect website. It's a really interesting thought. I wasn't aware of that suggestion, so certainly that's something to take away. So currently they're quite separate. So there's the directory of services, if you like, and then there's the PA register, but we could certainly think about whether we can combine those into one place and make that an easier thing to follow. So thank you for that. I'll follow it up.
And then my other question relates to commissioning. I don't know if part of this transformation that you're doing involves commissioning and looking at how commissioning is done. Because I recently, myself and Councillor Barnes recently met with somebody from the Equal Care Co-op, and she was saying that the way that Calderdale commissions actually disadvantages smaller providers, and we wanted to look at that. I don't know if we need to bring that in as a separate item on scrutiny at some point, Councillor Blackburn, to look at how commissioning's done and is that disadvantaging smaller providers?
Yeah, thank you for that. So we can certainly add that to our work programme. So Councillor Pillai, oh, Anne, would you like to come back in on that? No, you've got a historic hand up. That's why it's trying to confuse me. Anyway, there we go. Councillor Pillai.
Thank you, Chair. Like Councillor Barnes and Councillor Hutchinson, initially I had very many questions to ask, and I still have. And you will probably know that I'm not a newcomer into Calderdale, so I have got some knowledge of what's gone on in the past. I wish that we had this subject a long while ago in smaller bite chunks to be able to have scrutinized in detail. And having been in the health and social care arena for some time now, I'm still not convinced. And like Councillor Barnes said, I wouldn't want to say too much just in case I incriminate myself in my thoughts. Therefore, I'm going to suggest to Anne and to Jill, maybe coming from other organizations, I would like to see a spreadsheet with some of the risks under the various headings in different signal colors. Because my concerns are, what are the risks to the organization that all these changes is taking place, that is not been embedded into the system, but that will pose some questions later down the line. So I think for the benefit of all of us, it might be useful to highlight where the risks are in social care system as it stands. And likewise, as Jill has already alluded earlier on, there are more questions on the financial side for me as well, having been a previous provider for small businesses. And I think we are at risk and have been at risk in Calderdale for a hell of a long time, really, in terms of isolating the small operators in favor of the big boys. And that is one comment I will have to say. I'm going to stop at that. I'm not going to hog the whole scene because I'm sure other members have a lot to say. But I think this is going to take another few scrutinies for us to do some searching questions before we go any further.
Thank you, Councillor Bill. And I think that's probably quite a useful suggestion in relation to having a review for the transformation programme full stop, where we are and where we're achieving and things. So perhaps something to take on board, but we can certainly discuss that further. So I have Councillor Prashad next, please.
Thank you, Chair. You've mentioned that there is a backlog on S42 inquiries, which should be cleared by the end of March. Can you confirm that no Calderdale residents are at risk due to this backlog?
Shall I come in there, Councillor Bradbury?
If you wouldn't mind, yes, please. Thank you.
Yeah, so the position that we're in now is infinitely improved from where we were when we were having, just everything coming in as a safeguarding concern, and it will continue to improve as we embed the safeguarding team and the thresholds. And just to take the opportunity here to say that the creation of the safeguarding team is also not a restructure. It's about moving people and functions and responsibilities within teams. So we haven't increased our staffing complement or made anybody redundant or taken any posts out at all. It's about putting things into the right place. There's always a risk with safeguarding, always. You can't have a zero risk, but I am very confident that the way in which we're organised now, both in our waiting lists and in our safeguarding waiting lists, that we have a very robust triage arrangement where we are daily and often several times a day checking on who's waiting, what they're waiting for, being in contact with people to make sure that they are still safe. It's a dynamic process, so you don't sort of sit on a list and as the list grows you get further away from being seen. That's not how we operate. It's a dynamic process where we're constantly re-evaluating risk on a daily basis. There isn't a local authority in the country who hasn't got a waiting list both for services and for safeguarding. I think that the really important thing to be and you're right to challenge, and we challenge ourselves on this every single day, but the most important thing is that we're keeping up to being in contact with people, considering whether anything has changed in that person's life, considering whether anything has changed in for example, the care that they're receiving, or any new concerns that are being raised by family, by providers, etc. So I think that's probably as much as I don't think I could hand on heart to say, and I don't think anyone in any local authority could say there is zero risk for people. People live risky lives, don't they? We need to be assured, and you need to hold us to account, as you are doing, on have we got the right systems and processes in place? Have we got the right resources in the right places? I think with the arrangements that we've given a high level view of this evening, that we are in good shape to make sure that people are being contacted and being seen. There's always more we can do. We've had a really positive debate earlier on today about other ways that we can be even more robust about that triage arrangement. And we'll keep working to assure ourselves and to assure you that that's the case.
Thank you. Councillor Ridwan.
Thank you, Chair. One of the things I wrote, which I know has been said before, about the amount of information that we've had to absorb, and I would certainly, at least having a written report in advance, would have given us a better chance to scrutinise this. It's really hard to take everything in. Try and make sure you've not missed anything. Has there been an answer to the question already? And and whilst you're trying to make a note of one thing, missing something else. So I really would accept the need for giving the sort of the high level report, but a written report I think would have made it an awful lot easier, and the quality of the scrutiny I think could be a lot more thorough. There's one specific thing I would like to ask, and that relates to the safeguarding issue again. And again, I might have missed something, but I think you've said that a lot of things that were raised as safeguarding concerns were actually quality of care issues. But it strikes me there's a continuum here, and quality of care could be so much of a concern that it merged into a safeguarding issue. And whilst I think we said quite a bit about how we address the safeguarding issues, I wasn't quite. I would be interested to know more about that threshold and that continuum, and perhaps how we might address quality of care to prevent it becoming a safeguarding issue. Maybe that's something we'd need some more detail on that. But as I said, again, it seemed to raise more questions than answers, and that's just one part of it.
Thank you, Councillor Ridwan. Anne, do you want to come?
I think between Jill and I, we can probably cover this. So there is a very, very robust quality assurance approach, which Jill leads on, which we could, I think probably, Jill, it would be helpful to bring that here so that you can scrutinise that approach. But we are very robust on our quality assurance arrangements. I think one of the things that's going to be really important when we share the safeguarding thresholds, which have been co-produced across the whole partnership, is that we're also very clear about what the route then is for things that people have traditionally reported as a safeguarding concern, how that then is clear to partners about how they report that through the quality strand, or how they report it to CQC, for example, or how they robustly manage the quality in their own organisations. We're not the only authority to have ended up in this position, but for different reasons. So, for example, the ambulance service and sometimes the police, that's not the case here, but will report things in that are very they will report everything in as a safeguarding concern. So that is inherently unsafe, because if you have a gigantic volume of things coming in all called safeguarding, you are more likely to miss something that is worrying and that is genuine safeguarding, than if you can be clear with people about what the correct routes are to report things in through. But Jill presides over a very tight quality assurance framework, and I don't know, Jill, whether you want to say anything now, or whether it's something that you might want to ask Jill to bring into a future scrutiny, or whether we can do a bit of both, maybe a high level Jill now and then something a bit more detailed.
let's bring it back to another scrutiny. I think that's a topic in itself, which I think is important. So we'll go on to Councillor Barnes, please.
Thank you, Chair. I'm not entirely sure where we're going from here tonight, and what we're going to end up with. I mean, the impression I'm getting is that the feeling is this doesn't need to go to Cabinet for approval, despite it being the largest spend that we have within the budget. Adult social care is the largest spend we have in the social budget, but the impression I'm getting is that it doesn't seem to be going to Cabinet, which is a surprise. On that basis, what are our boundaries with partners such as Swift or the hospital, the NHS, and maybe we need to bring the ICB or perhaps Neil or Rona back in on this one. You mentioned at one point, and all system partners are ready to make the changes we have been talking about for some time. Keyword there for some time. I mean, these are some major issues that we need to pan out and look at. For example, is there a monthly sit rep produced? I mean, we get one from the hospital, don't we? Is the one with new cases, all the metrics, and what are the metrics that we're using to assess success here? These are the things that we need to be involved with, not presented with at the end of the day. And I disagree with in some part with Councillor Fenton-Glynn on some of those aspects. Is that we need to be involved in it, but I'm not sure where we go from here, Chair. I think your suggestion of having a separate meeting and doing this outside of this meeting is the way forward. I don't know whether the rest of the committee feel that this is the best solution.
I thank you, Councillor Barnes, and I think it is. I think that is the way forward. I think we do need to break it down. We need the full written report. Yeah, everything, including like how much we're getting in for the better care funding, what's it for. Just a breakdown. Probably a lot more detail. I know that sounds, but we equally need to be scrutinised. Bit chunk size as well. So we break it down so it's not all. We're not missing anything as well. I personally think we need to explore our own opportunities as a scrutiny panel to actually perhaps employ a consultant to help us to understand some of the things. Are we missing anything? So we'll discuss those. Councillor Fenton-Glynn, can I just bring you in? Then I'll bring Councillor Hutchinson in.
Yeah, just on Mike's specific point about what goes to Cabinet. It's parts of this will go to Cabinet. There's some stuff which is kind of sharpening of our day-to-day, which isn't, necessarily, it's just sort of changing the way things work. But things like the reimagining the day services will obviously go to Cabinet, as will kind of other elements of the changes. But it's, a lot of the time when big amounts of money come in or go out, that goes to Cabinet, unfortunately, because of the nature of those things. That's often the stuff that's below the line that's done in private. But just to give you that sense that bits of it will go to Cabinet. I think this is more, and I mean, thinking about it, we're probably having this conversation at the wrong time of the year, because actually this would be a very good meeting for May to give you a sense of what the next year and a half, 18 months is going to be. Well, and then giving you a chance to know what you're going to follow up on. I think because we've had a lot of staff turnover, and because we're now kind of re-embarking on this process, it feels a bit kind of out of kilter. And so you're getting this in February, when obviously there's going to be a restart in May. But I think this is the thing was, it was trying to keep you kind of a bit more engaged. But I think that's why we're at this stage with this, and maybe for those of you who are on this scrutiny board next year, it will also give you kind of a bit of an idea of where you want to be, where you want to be going on from this point.
Yeah, thank you, Councillor Fenton-Glynn. I think we did certainly Councillor Barnes and myself had a meeting with Anne and Kath Gormley, and we agreed an extension not for it to come to this, to delay it to come to this meeting to get more information. We need it's a plan that we need a lot more stuff and a lot more detail and a lot more questioning, and so we will. Yeah, and actually, no, it is important that we're discussing it now, not May. So I think it's really important that we are involved in the journey, because actually we want to ensure that residents in Calderdale are getting the best I'm sure they will. I'm sure they will do. Councillor Hutchinson.
Thank you, Chair. I mean, I agree. We need to sit down and actually work out how we build this into the scrutiny programme over the coming year. I mean, are we able to get copies of the slides that have been produced? Are those able to be attached to the publicly available information on the Calderdale website associated with this meeting, so that they can be referenced, because it's too much to actually take in? But I share Councillor Riveron's concerns as to where quality concerns merge into safeguarding. I mean, I don't know where inadequate levels of staffing within a residential setting fits into quality issues or safeguarding. I don't know where inadequate amounts or training in using manual handling equipment to avoid the breakdown, to try and reduce the incidence of pressure ulcers, fits into quality or safeguarding. I'd really welcome the ability to actually look into those sort of things in detail. But just specifically, the new call system that's being brought in, we all know how frustrating it is being left at the end of a phone line waiting to get through. Does the new call system offer a callback service so that the person who's calling in doesn't have to put their life on hold for an hour or so while they're waiting, but they're called back? Because some of the GP practice switchboards do. Does it tell you how many people there are in the queue before you, so you can make a reasoned judgment as to whether to actually call back another time if it's not something that's urgent? And my other immediate question is, for the Better Lives settings, what kind of locations are they talking about? What sort of a place are they going to actually be based in North Halifax, for example?
Thank you, Councillor Hutchinson. Jill, you had your hand up at once, so you're trying to confuse me by putting up and down. Do you want to comment on any of that, please?
Thank you, Councillor Blackburn. I was just going to come back in on the quality and pick up on Anne's previous point. We do have a really comprehensive, what we call a multidisciplinary risk assessment in place. We rag rate all of our providers in terms of based on intelligence from the whole system through ICB services, the CH Foundation Trust, and our council quality colleagues. We monitor improving trends or declining trends, and all of that is informed based on the intelligence we receive across the whole system. So I would happily bring that in if Scrutiny wanted to look at that, and we could link that across as to when the quality tips across into what we would say whole-scale safeguarding, large-scale safeguarding inquiries.
Thank you, Jill, for that. And do you want to come back in on the telephone system? Do you have that expertise knowledge?
So the callback process and the where you are in the queue, yes, where you are in the queue will be there. Callback process, callback offer, I don't believe we have got that included in it currently. We're not sufficiently well resourced to manage that at the moment. The location of the community-based talking points, we are very much co-producing that. So we are working with community organisations, voluntary sector organisations, residents. So we are about to launch our first community voice group, which is going to move around the whole borough. People can, being supported to join that, to give us their time. We're going to reward that. It's very difficult with reward and recognition for people's participation if they're on benefits, but we're looking at ways of providing travel expenses, giving, making sure that people got something to eat, giving vouchers, those kinds of things, because they're giving us their time and their expertise to say which kind of organisations, which kind of locations, which days, which times are the best. We are keen to avoid statutory buildings because we know that from experience elsewhere that they're more intimidating for people. We want to use places that people already go to, so community organisations. But there's a whole range of sort of places that people will tell us where is appropriate for them. So we've had some really brilliant contact with the Women's Activity Centre, for example, who have given us some really good insights to what does and doesn't work for them. So there will be no one size fits all. It will be about what is appropriate for that each local community, and that won't be fixed either because things will change over time as we reach more and more people. So we're having a very flexible approach to that. We have a permanent co-production lead, Hayley Parks, who's doing a brilliant job of making some fantastic connections and building her network to ensure that we are hearing from people who we haven't previously heard from or we haven't consistently heard from. So we're at the beginning of that journey. There's a load to build on because of the work that people like Sian Rogers and Faye Henderson, who I mentioned earlier, have done already. So we, Councillor Barnes, you said that there was no mention of co-production. If I didn't say it, then I'm sorry about that. I think I did, but we are definitely co-producing all of this work, to the best of our ability. We are at the beginning of that. We will get better and better at it. We're connecting up with social prescribers and community engagement leads. We're working with the Council of Mosques, for example. So we are really doing I think a whole lot better on co-production than perhaps we've done in the past, but there is a way to go, and you're right to question that.
Thank you, Anne. Councillor Pillai.
Thank you, Chair. Just as already been alluded by Councillor Hutchinson, I was also going to suggest that we get a copy of the presentation from both Anne and Jill today. That will give me a bit more time to consider what further questions that I want to pursue thereon. Thank you.
Thank you, Councillor Pillai, and thank you, Anne and Jill. Anne, you've come with the first meeting you've come to, and as assistant director is the most challenging one that will be probably for your career in some ways, because it's opened up an awful lot of extra questions, as you can imagine. I think at this stage what we're going to do is we do need a written report and clear plan and timescales and costs. I think we do need the meeting as well, so I think I'd suggest that Councillor Barnes as deputy, myself and Jill and Kath have a meeting to discuss our work programme and when it's appropriate to bring items to the table, as in the open scrutiny. I equally think I'm going to ask Mike Lodge and Libby they will have been taking various notes and various comments, so we can bring those together as well, rather than trying to list every single thing that has been mentioned. There's been an awful lot of things mentioned, a lot of questions. So I think we'll formulate that. We'll have the opportunity for members to email Mike and Libby with any other things as well once we get to that stage. Does that make sense to members on the panel? Okay, and a way forward. I think it's a way forward, and just so we get a better, wider understanding of everything. It is a big work program issue. It's a big, massive transformation, and I know Rome wasn't built in a day, but at least we can chip away, and we can then see what we can do. I'd like to get to a stage where Scrutiny can equally submit comments to a cabinet on recommendations to cabinets. If we feel that is appropriate. So let's work on it. It's work in progress, but appreciate the slides and the overarching picture that you presented this evening. I know it's not easy to present every single detail, so I equally appreciate that as well. So and I say it's been well worth spending the time we have spent this evening to get to where we are. And everyone's looking at me and saying, well, we haven't really got anywhere, but we are. I think we at least we've had that initial conversation. So let's continue with that and let's move forward. So thank you for that, and we now move on to item number 7, which I think is a really dull item, I'm afraid. It's the non-surgical oncology program update. There's nobody here to present that. Both myself and Councillor Hutchinson attended a lengthy meeting about this some time ago. I can't recall when it was. The reports, I have to say, it's really tedious. It's a really tedious report, and I found it really hard reading. So hard reading. So I almost wanted to. I was shouting at the report saying, "Get to the point. What is the whole element of this? What are we trying to achieve, and what we're trying to do?" So if anyone's got any comments whatsoever, then please feed them in. Yeah, but certainly it seemed to be a however many page report that could have been written on 2 pages, to be honest, in my humble opinion. So that's my view. Does anyone have any comments in relation to the report itself? Councillor Hutchinson.
I mean, I did get a chance to air my comments when this came to the West Yorkshire Joint Health Scrutiny Committee, and the comments are still the same, because essentially the proposals are based on a report by Professor Keith Richards, and we're not permitted to actually see this report yet to know what suggestions were made, which I find. They say that they will publish it as part of the wider consultation papers. As you say, the report beats around the bush. I mean, there's nowhere very clearly says, you have to tease it out that the proposal is that there'll be a second centre for acute oncology in Calderdale and Huddersfield Foundation Trust, although they switch between saying Calderdale and Huddersfield and Calderdale. And I believe that I've worked out that the beds to accommodate this will be at Huddersfield Royal Infirmary, but their sense of geography seems to be very, very vague. And whether they're accommodating them in Huddersfield is a temporary measure until such time as the building works should ever be complete on the Calderdale site, or whether that's a permanent move, I'm none the wiser. The whole rationale for this seems to be down to the problems of recruiting and retaining a sufficient consultant clinical oncology, non-surgical oncology workplace, and they're saying that it's because of the pattern of work in Yorkshire and the Humber. But looking at the Royal College of Radiologists workforce census from last year, every part of the country is suffering this, apart from in London, where they have double the number of non-surgical oncologists that we do in West Yorkshire. But the Midlands are worse off than us. North Wales is particularly badly off, and these are apparently places that are running a hub and spoke service. So I don't see that it's the pattern of service that's the main problem. And within the 20% of consultant oncologists are due to forecast to retire in the next 5 years. The shortfall of oncologists is 15% currently, and due to increase to 25% by 2027. And there is very little here to say that how they will ensure a sustainable workforce, even with this reconfiguration, if the workforce pattern is getting worse and worse over time. So they say that they've increased the number of training places for oncologists in West Yorkshire. My understanding but that not all the places have been taken up by trainees. I would like to know a lot more about what they're doing to try and grow the workforce here. You know, is it that that it's not, you know, there's lots of ways of making the job more attractive that don't involve paying people more money, essentially. But is it that my understanding is that this is a short-term funding issue, the short-term funding being put in to increase the number of training places, and the worry is that if they're not all filled, that the Department of Health will pull that funding, and you know, and they'll you know, that potential solution will go. So. But it's a terribly written report. I agree.
Thank you, Councillor Hutchinson. Michael, do you want to come in on that part?
No, I'll wait till members are finished.
That's fine. No, that's fine. That's okay. Councillor Barnes, next, please.
I think Chair, yourself and Colin have been generous in your assessment of this report. It's probably the worst report I've ever read. And you know, that's saying something. You know, I think I had to read it 3 times before I understood what I think I understand what it was going through. And I know this is not about questions because we've got nobody from there for us to ask questions to. And I think, you know, I made the fatal error of letting Colin put his hand up before I asked some of those questions. You know, I thought I'd got away with it once earlier, and I did, and I failed a second time. So my bad there, folks. But I think the key thing that Colin's put out is the report upon which this is based, which has produced an answer, but we don't know what the report is and what it said and what its conclusions were, and therefore is this the real answer to the solution? You know, has it been figured into the hospital, the so-called hospital reconfiguration? You know, which I think the last time was it 2029 was the last time we heard, but since then. Nothing seems to have moved since then, so we're not even sure whether 2029 is the hospital reconfiguration date. So, you know, ask questions. I think Colin is doing a more, and yourself are doing a more than good enough job on that, Chair. But I think we need to factor back in that if they're going to produce a report that's readable.
Absolutely,
you know.
Totally.
Thank you,
agree.
Chair.
Well, I didn't think I was in the same meeting. I had to read it twice to think I was in that meeting. I don't know what happened, but yes, indeed. Councillor Kingstone, please.
Oh gosh, I didn't realise I was already unmuted. Apologies for that. What was I going to say? Well, I think you might have all given me the courage to admit that I actually fell asleep while I was reading this report, which was I really genuinely did. And I struggled to keep myself awake whilst reading it. I did spot during the wakeful periods that there were a few unexplained acronyms, always my bugbear. I've no idea what SACT is. And was it GAIL, GHAIL, I think it was one of them as well. I've no idea what they are. And then I wrote in massive, I use one.gov to annotate, massive letters across it, that what struck me loud and clear was that there's been a catastrophic failure of planning historically that has resulted in this, that somewhere along the line, someone hasn't planned doctor training and doctor specialisms properly, and we've been badly let down by failures in the system at some point, which has led us to this point. But I agree with Colin's analysis. There's not enough evidence from what we can see there to say that the proposed changes will improve. It says it's to improve the service. I couldn't see any evidence that it really will improve the service, or that the system that they're wanting to switch to, which is used elsewhere, is better than what we do already. And it does look like it would involve a lot more travel for people using the services, and I'm always wary of that, because I think that particularly impacts people in the lower socio-economic groups, which this report says are already disadvantaged. They've already got higher cancer rates in those groups. So yeah, not at all impressed. That's it. Thank you.
Thank you. Councillor Hutchinson has put in the chat. Thank you, Councillor Hutchinson, that SACT is systemic anti-cancer treatment, but you wouldn't have a clue reading the report. So thank you for the clarification. Councillor Pritchard, please.
Thank you, Chair. I won't talk about how boring the report was, but something struck me when I was reading it, that if only 23% of patients over 80 years old are treated with surgery, are they saying that 67% of patients are not offered surgery due to a poor prognosis, or are they just too old? Is it something we have to look forward to when we get to 80?
Thank you for that. I'll bring in Mike at this stage in that case.
Yeah, thank you, Chair. It wasn't about the detail of the report particularly, but just so the scrutiny of this is taking place at the West Yorkshire level, and Councillor Hutchinson and Councillor Blackburn are our members there, and members of that joint committee last time did say their thoughts or ideas or questions should come back from local places, which is why we brought it onto this agenda, and why we've not brought, it's not brought the people from the NHS to this meeting, because otherwise they'd be doing it twice effectively. So it's not. I just wanted to firstly to be clear that it's not that they haven't turned up. That's how we arranged it. So no fault. Secondly, I think that in the NHS, one of the things that I've learned sometimes sort of it's led me down the wrong path is that sometimes they talk about Calderdale as a shorthand for Calderdale and Huddersfield Foundation Trust, and I've been in meetings where I've thought, hang on, and eventually work out that's what they're doing, but that's not helpful. And thirdly, every June we bring a report that asks for you to appoint to the joint committees, and I wonder whether when the report comes in June, we ought to perhaps do a little bit more than just talk about who should be appointed to it, and perhaps talk a little bit about how it's working and some of the issues that are coming up. Because I mean, Councillor Hutchinson has, I think virtually every issue we discuss at West Yorkshire has a workforce issue. Lots of, and frequently the consequences of that are proposals to reduce the number of sites that service is delivered from across West Yorkshire, which has the smallest of the 5 places in West Yorkshire, is something we always need to watch out for carefully. But so perhaps in the first meeting of the new municipal year in June or whenever it might be, is perhaps to pay a little bit more attention to that rather than just appointing people. Thank you, Chair.
There we go. If anyone wants to take my place, be more than welcome. Judging on this report. So, Colin, sorry, Councillor Hutchinson, my apologies.
No, I think what we needed back from this committee was their thoughts on, assuming I've got it right, and the idea is to locate these acute oncology beds for Wakefield, Kirklees and Calderdale at Huddersfield Royal Infirmary. Are we happy that they're going to be located there? Are we content with the idea that they'll be located there rather than in Pinderfields or somewhere else? Given that the feedback that they report from patients and their carers is that these acute oncology services are for people who are on treatment who run into serious complications from their treatment, or people who are pitching up at accident and emergency with acute symptoms and they say, oh, this looks as if it might be due to cancer, we need to get you to see especially somebody pronto to see about that. So it looks as if when patients are actually asked, would they be prepared to travel to somewhere that's set up to actually look at this properly, or would you like us to try and make do and mend at our local unit? They generally say, for that purpose, I would like to be seen by somebody who knows what they're doing, which seems quite reasonable. But that the proposal is that for people who are on courses of chemotherapy where they're having repeated infusions over a period of time, that will still take place in their local hospital. So it's not shifting all the oncology services to just two centres. It's that acute sort of time critical stuff that would be done just either in Leeds for Leeds, Bradford and Airedale, or in Calderdale and Huddersfield for Wakefield, Kirklees and Calderdale. So, and looking again at what the patient engagement suggests is that they're really asking for beefing up of the services that are available in the community for palliative care and for and for the services that are cancer services that can be delivered through their own doctor. And there is some mention of that, but it's quite wishy-washy, and it's difficult to know exactly how well they're committing to that in the long term.
Thank you, Councillor Hutchinson. Councillor Kingston.
I know that you to feed back some comments, and I just thought that maybe you could ask for the report to be rewritten, basically, or for something to come back that's actually got some diagrams in it, some flow charts maybe, that would help us to more easily access an understanding of what the proposals are. Because at the moment we're having to understand it all just from text, paragraph text, and I find this kind of configuration much easier to understand from diagrams. I'm sure that will be true for a lot of other people as well. So if you want to feed back a comment, that would be mine.
Okay, no, thanks for that. Councillor River, you sneaked in there, but because I always like your questions, so you're more than happy to raise it.
Not got very much to add, but does that seem to be really important questions that really have major significance. And I shared everybody else's difficulty with the report. I had Anne's problem with staying awake when to read it, but these are actually crucially important questions. And there's always going to be a balance between something that's local and accessible and the level of expertise you can get from a regional centre. I don't feel equipped to make those judgments. I do realise it's a crucial question, and I think to have anything meaningful, I do think we need some. We can. I don't know what we can say than that, but I couldn't make a judgment on what we've got here. But I do recognise it's a crucially important question, and I think also the point that I made really about additional travel, particularly impacting on those lower socioeconomic groups who have the worst outcomes anyway. But other than saying that we're concerned about it, I don't really know what else we can say. And we would have liked something more accessible where we could have actually had some meaningful input into that.
Thank you, Councillor River. And I feel slightly better that you felt the same about the report. It does assure me that it wasn't just me. And I guess the conclusion of this, actually, if anyone does have any burning questions, then send them via mic, and we'll feed that information through the meeting. I think that's probably the most sensible approach to deal with this particular item. So we'll swiftly move on to something a little bit more exciting, or not, which is the work programme. I'm looking for Mike. Do you want to create your 2-minute slot or 1-minute slot, 30-second slot? No.
Well, I don't know if Libby's got anything to say first.
I've got nothing major to raise other than, obviously you've already said it, Councillor Blagborough, but we've been scribbling down notes about what was mentioned in the first item, so we'll definitely work to produce something for maybe next year now or next municipal year to reflect what members are interested in.
Super, that sounds good to me. Mike?
I mean, not much to add to. I mean, we need to have that meeting that you asked for earlier on. That will produce another item, as you've requested, I'm sure, for March. But it may be that this process means that you're setting next year's work programme a bit more in advance than you normally do, because the questions that you raised in the earlier item, I imagine you will want to programme throughout, you know, certainly the first half of next municipal year, if not the whole year.
Yeah, so superb. Yeah, no, totally on that one. So we'll take that as the work program. We've done extremely well considering it's only 20 to 8. So actually, even though we've had a very, very meaty agenda item, I think we've still got through very quickly. So thank you for your attendance. As always, on your inputs, your valuable inputs, and at this stage, I will close the meeting and wish you a good evening. So thank you once again.